Welcome to part 2 of this series of videos on GLP-1 agonists. In this video, we'll be talking about the differences between GLP-1 agonists and other medications used to treat type 2 diabetes. We'll talk about the differences on how they work and advantages and disadvantages over each other. The information provided in this video should not be used for diagnosing or treating a health problem. Consult your healthcare provider before making any changes to your health plan. Here is a list of main medication classes that are used for the treatment of type 2 diabetes. There are other classes, but they are not as widely used, so we will only discuss the ones listed. Insulin, bigonides, and sulfonylureas are the oldest medication classes listed here and have been used for decades. Newer medication classes include GLP-1 agonists, DPP4 Inhibitors, and SGLT2 Inhibitors. We will discuss each class in much more detail. Also worth noting is that many of these products are available as combination products of multiple classes because of how they complement each other in reducing blood glucose levels. Before any medication is given to a patient for the treatment of diabetes, an evaluation of their diet and exercise habits are assessed, and lifestyle modifications are suggested. If even after these changes the desired blood glucose levels are not attained, the patient's physician will determine which medication or medications would be best for the patient. Remember, diet and exercise is always the first step. Let's first discuss bigonides, specifically Metformin. The first medication that is usually prescribed is Metformin. Metformin is a widely prescribed oral medication used primarily to manage type 2 diabetes. It belongs to the class of medications known as bigonides and has become a cornerstone in the treatment of this metabolic disorder. Metformin is valued for its efficacy, relatively low risk of hypoglycemia, and potential to improve insulin sensitivity and other metabolic parameters. Metformin's mode of action involves targeting multiple aspects of glucose metabolism in the body. The primary mechanisms include decreased hepatic glucose production, improves insulin sensitivity, enhanced muscle glucose uptake, altered gut glucose absorption. Some of the clinical uses of metformin is that it's primarily prescribed to individuals with type 2 diabetes, especially those who are overweight or obese. It is often used as the initial pharmacological treatment after lifestyle modifications such as diet and exercise have proven insufficient to manage blood glucose levels on their own. Metformin can be prescribed as a monotherapy or in combination with other anti-diabetic medications, depending on the patient's needs. Metformin offers several benefits in the management of diabetes: effective glycemic control, minimal hypoglycemia risk, and weight neutral or weight loss effect. So metformin is generally considered weight neutral or may even lead to modest weight loss. This can be advantageous, again, for those who are obese or struggling with obesity. There are also cardiovascular benefits with the use of metformin, such as reducing the risk of heart disease, although this is an evolving area of research. Adverse effects are generally favorable compared to other anti-diabetic medications. So some of the common side effects of metformin include gastrointestinal disturbances such as nausea, diarrhea, bloating, abdominal discomfort, but these can be managed by starting at a low dose and gradually increasing the dose over time. In rare cases, a serious condition called lactic acidosis may develop, but the risk of this is very low. In conclusion, metformin is a foundational medication in the management of type 2 diabetes due to its ability to lower blood glucose levels by targeting various aspects of glucose metabolism. Its effectiveness, minimal risk of hypoglycemia, and potential for promoting weight loss make it a valuable choice for many patients with type 2 diabetes. However, as with any medication, its use should be carefully monitored by healthcare professionals to ensure safety and efficacy. The next class we'll talk about are sulfonylureas. They have been used for several decades and work by increasing the secretion of insulin from the pancreas. While they have proven effective in lowering blood glucose levels, there are important considerations and potential side effects associated with their use. Sulfonylureas exert their effects primarily by stimulating the beta cells in the pancreas to release insulin. They bind to specific receptors, which triggers a series of events leading to increased insulin secretion. Sulfonylureas are glucose independent, meaning regardless of what the blood glucose levels are, it can still cause insulin release. Therefore, there is an increased risk of hypoglycemia if blood glucose levels are not monitored. Some clinical uses for sulfonylureas. For those who have not achieved adequate glucose numbers through lifestyle modifications alone, they are often given sulfonylurea as a second-line treatment after metformin or in combination with other anti-diabetics. There are two types of sulfonylureas, first generation and second generation. The second generation is more widely used today because they do have a lower risk of hypoglycemia than the first generation. Some benefits associated with this product class: effective blood glucose lowering. It is ease of use. They are taken orally and it's usually just once or twice a day. However, there are some considerations that need to be discussed. There is an increased risk of hypoglycemia because of the insulin release. Associated with that is weight gain. So when insulin is released, blood glucose is deposited into the fat cells and muscle cells, which could cause weight gain. Beta cell function could also decline over time with the use of these products, and also cardiovascular effects. However, there's much more research needed to see if this product class does have a negative effect on the cardiovascular system. Also, there is an increased risk of allergic reactions to sulfonylureas. In conclusion, this class of medication can effectively lower blood glucose levels, but they do come with the risk of hypoglycemia, weight gain, potential decline of beta cell function over time. As with any medication, the benefits and risks of sulfonylurea therapy should be discussed with your healthcare professional. Next, a new class of products, SGLT2 inhibitors, also known as sodium glucose cotransporter 2 inhibitors, are a class of medications used for type 2 diabetes. These medications work by targeting the kidneys to reduce blood glucose levels through a unique mechanism of action. So they don't target the pancreas or liver, they do target the kidneys, so it is different. SGLT2 inhibitors have gained popularity due to their effectiveness in lowering blood glucose, promoting weight loss, and potentially offering cardiovascular and renal benefits. So again, this class of products primarily acts on the kidney to inhibit the action of what's called a sodium glucose cotransporter 2. This transporter is responsible for reabsorbing glucose from the kidneys filtrate back into the bloodstream. So by inhibiting this cotransporter, you don't reabsorb that glucose back into your kidneys, and hence it's eliminated out of your body through urine, and therefore your blood glucose levels come down. Some clinical uses for this product class. It's of course used for type 2 diabetes on individuals who need additional glucose lowering agents beyond lifestyle modification and other oral medications. They can be used as monotherapy or in combination with other drugs, depending on the patient's needs. Some benefits from this product class: effective glucose lowering, weight loss. So the weight loss occurs from the elimination of glucose from the kidney. Also cardiovascular benefits, such as including a reduced risk of major cardiovascular events like heart attack or stroke, as well as improvements in heart failure outcomes. There are some renal benefits, associated with its direct interaction in the kidneys. Blood pressure reduction as well. As the glucose is eliminated from the body, it does also have a positive effect on blood pressure. There are some considerations on adverse effects. There is a risk of genital and urinary tract infections, ketoacidosis, dehydration, and hypotension, and an adverse effect on bone health. But this is still under research. So in conclusion, SGLT2 inhibitors are a unique class of anti-diabetic medications that lower blood glucose by acting on the kidneys. They offer multiple benefits, including glucose lowering, potential weight loss, cardiovascular and renal benefits. However, patients should be aware of their side effects and discuss with their healthcare provider on if this class of medications suit their needs. The next class are the DPP4 inhibitors, also known as dipeptidyl peptidase 4 inhibitors. It's a class of anti-diabetic medications used to treat type 2 diabetes. These medications work by targeting the enzyme called DPP4 to enhance the action of incretin hormones, which play a crucial role in regulating blood glucose levels. So if you recall from the part 1 video where we talk about how GLP-1 agonists work to increase the effect of incretin hormones, this is very similar to that. It just works in a different step of the chemical pathway, but the end result is very similar, that it increases the action of incretin hormones or incretin hormones. The DPP4 inhibitors act by inhibiting that enzyme DPP4 which is responsible for the breakdown of incretin hormones. So once that enzyme is inhibited, the incretin hormones are not broken down, so there's a higher level of these hormones to perform action. Also, this product class stimulates insulin secretion from pancreatic beta cells and inhibits glucagon release from pancreatic alpha cells. By inhibiting DPP4, these medications increase incretin hormones like the GLP-1 and the GIP, which is a glucose-dependent insulinotropic peptide. Some clinical uses. This product class is used in patients who require additional medications. It's typically not a primary choice. It is second-line therapy after lifestyle modifications and first-line medications like Metformin. There are plenty of benefits for this product class as well, such as effective glucose regulation. There's a lower hypoglycemia risk, similar to the GLP-1 agonists. Weight neutrality. So there's no evidence that it leads to weight gain or loss, so it's weight neutral. Some of the negatives for this product class: there is a risk of gastrointestinal symptoms such as nausea, stomach discomfort, or diarrhea. Also, a risk of pancreatitis does exist, though it's rare. And also a risk of allergic reactions to this product type if you are sensitive to this class. Renal considerations as well. There may be some dose adjustments that may be required if you do have pre-existing renal dysfunction. So your healthcare provider may adjust the dose based on that. So do keep that in mind. There are, again, several benefits for this product class. It is similar to the GLP-1, but it can be used in combination with other product classes when required. Next, let's talk about the oldest product class, insulin. So insulin is different than the other product classes that we are talking about. It can be used to treat type 1 or type 2 diabetes. So insulin is a hormone produced by the beta cells of the pancreas. It plays a fundamental role in regulating blood glucose levels and is essential for maintaining normal metabolism and energy utilization in the body. So insulin primarily works by facilitating the uptake and utilization of glucose by various cells in the body. It acts as a key that unlocks the cells, allowing glucose to enter and be used for energy. This process occurs in the following way. First, there is glucose uptake into the cells. Then there's a glucose transport from within the cells. And then there is energy production. So once the glucose is inside the cell, it's metabolized through various pathways to produce energy that can be used for various body functions. In terms of role in blood glucose regulation, insulin is critical for maintaining blood glucose levels within a narrow range. After a meal, when blood glucose levels rise due to the intake of carbohydrates, the pancreas releases insulin into the bloodstream. Insulin enables glucose to be transported from the bloodstream into cells, thereby reducing blood glucose levels. When blood glucose levels drop, such as between meals or during physical activity, insulin secretion decreases, allowing stored glucose in the liver to be broken down and released into the bloodstream to maintain stable glucose levels. So as mentioned before, insulin can be used for type 1 and type 2. Insulin comes in various forms and different types, such as long-acting insulin, intermediate, regular, or rapid. It comes in syringes, insulin pens, insulin pumps, so various types exist. So in summary, insulin is a vital hormone responsible for regulating blood glucose levels, and it can be used as added therapy for individuals with type 2 diabetes. Now let's talk about GLP-1 agonists, which is our area of focus. So in part 1 of the video series, we discussed in detail about what GLP agonists are and how they work. I posted a link to the video in the description below. However, I will talk a little bit about the benefits and disadvantages of this class. Some of the benefits include glucose regulation, a lower hypoglycemia risk, weight loss, which has been very popular in the news and social media nowadays for this product class, and also the potential of positive effects on the cardiovascular system. And something that is emerging in research is possible renal benefits, but again, it's early on and more research needs to be done. Some of the adverse effects associated with this product class: gastrointestinal symptoms such as nausea, vomiting, diarrhea, stomach discomfort, especially when starting the medication, but they usually improve over time. Rare cases of pancreatitis have been reported. Weight loss and nutritional status. Now, weight loss is generally a good thing for, of course, obese patients, but there could be diabetic patients who are struggling with their nutrition or are underweight. So additional weight loss could be detrimental to their health. So before beginning this product class, do discuss with your physician about your normal weight and your weight stability and your nutrition. There is also a risk, or a warning, I should say, of thyroid C cell tumors. In animal studies, there were reported cases of thyroid C cell tumors. However, it has not yet been seen in humans, but there is a warning in each of these products' labels, so everyone is aware of that. And further research is ongoing to monitor if these tumors do develop in humans. Here is a summary table of some things we've already discussed, plus some information on product formulation and dose frequency. Generally, individuals will prefer taking oral medications versus injections. Biguanides, specifically Metformin, sulfonylureas, SGLT2 Inhibitors, and DPP4 Inhibitors are all oral medications taken once or twice daily. Insulin is predominantly subcutaneous injection. However, there is one form of inhaled insulin called Afrezza inhalation powder that is available on the market. I have not discussed that here, but this product does have its own use and risk profile that would require a separate discussion. Getting back to our main point of comparing the other anti-diabetic classes to GLP-1 agonists. GLP-1 agonists are predominantly used or available as injection. However, there's one product available as an oral tablet, the trade name Rybelsus, which has the same active ingredient as Ozempic and Wegovy. We'll talk about more about the differences between each one of the GLP-1 products in the next video. GLP-1 agonists are given anywhere from daily to weekly depending on the product. So yes, some of the medications of this class do require daily injections. So if that's something that is not for you, talk to your doctor about that so they can prescribe an alternative. Some other things to think about. Will you be compliant taking in a daily oral medication versus a weekly injection? So if you don't like injections at all, maybe GLP-1 agonists are not for you. A combination of Metformin and one of the other product classes may be better. However, if you have more of an issue with daily compliance, then you may want to take a weekly injection instead, so you don't have to worry about daily administration. So everyone is different. Discuss openly and honestly with your physician so they can help you help prescribe the best product for you. Each of the product classes listed here work in different ways and can be used in combination to optimize the lowering of blood glucose levels. Some product classes are more effective than others in controlling blood glucose levels, but the efficacy must be weighed against the risk or adverse effects of each product. That is why Metformin is usually the first medication provided. It has good effectiveness and a positive risk profile compared to the other product classes, which make it the obvious first choice. After that, the choices will vary depending on the patient's health status. For example, if the patient is obese, sulfonylureas would not be a good choice as it could lead to weight gain. Your physician may consider GLP-1 agonists or SGLT2 inhibitors. Managing diabetes requires a multifaceted approach, and various classes of medications are available to address the diverse physiological aspects of the disease. The GLP-1 agonists stand out among these medications due to their unique features and distinctions from other diabetic medications. For example, the mechanism of action. GLP-1 agonists mimic the actions of the natural hormone GLP-1. They enhance insulin secretion, suppress glucagon release, slow gastric emptying, and promote satiety, collectively leading to improved glycemic control, weight loss, and potential cardiovascular benefits. The other product classes primarily target insulin resistance, insulin production, or glucose absorption. For instance, Metformin addresses insulin resistance while sulfonylureas stimulate insulin release from the pancreas. In terms of weight management, GLP-1 agonists are associated with weight loss due to their appetite suppressing effects and delayed gastric emptying, which reduce food intake and promote satiety. Other medications typically either are weight neutral or can actually lead to weight gain. Cardiovascular benefits. The GLP-1 agonists have demonstrated cardiovascular benefits, including reduced risk of major cardiovascular events, improved lipid profiles, and blood pressure reduction. And as we talk about the individual products, you'll see that some actually have the indication from the FDA to improve cardiovascular health. The other medications in the other classes have shown some cardiovascular benefits. Others may have neutral or even detrimental effects, as we talked about earlier on in this video. The route of administration, GLP-1 agonists are typically injections. There is one exception, Rybelsus. They are available in various formulations such as daily or weekly injections. Other medications in other classes are typically oral tablet, which may be convenient for some. In terms of hypoglycemia risk, GLP-1 agonists have a low risk of hypoglycemia, making it an advantage over most of the other product types. The medications in the other class, specifically sulfonylureas and insulin, do carry a higher risk of hypoglycemia. For the pancreas beta cell preservation, GLP-1 agonists, there is evidence that there may be a positive impact on the beta cell function. For other medications, there may or may not be a positive effect. It does vary amongst the other groups. For kidney function, GLP agonists have been shown to have renal benefits, including slowing the progression of kidney disease in patients with diabetes. In the other classes, some of the medications may not have significant renal benefits. So in summary, GLP agonists offer a distinctive approach to diabetes management by mimicking the actions of GLP-1, a hormone which with broad effects on glucose homeostasis, weight regulation, and potential cardiovascular benefits. The mechanism of action is different than the other product types, and some of the unique features of GLP-1 agonists make them a valuable addition to your potential anti-diabetic treatment portfolio, particularly those individuals who may benefit from weight loss and cardiovascular risk reduction. Now that we have talked about the main differences in the different diabetes medication classes, let's talk about the individual GLP-1 agonists and how they differ from each other. We'll do that in the next part. Remember to subscribe to our channel and like and share this video. Thank you.